I'm so excited, Dr. Gopal, to have you here. You look great. How are you?
I'm doing very well, Ethel. How are you?
I'm good. Wow. So it's been since graduation. How many years ago now?
Yeah, it's been a long time. Yes.
Yeah.
What is it? Almost coming to 10, I would think.
Ooh, I can't
Almost.
believe it. Time
Yeah,
flies when you're having fun.
exactly. Exactly. Yeah.
Well, you are still doing great work, and April is Public Health Awareness. Well, I'm going to say month, but we celebrate Public Health Awareness Week. So I thought today we could talk about the power of public health and how it impacts our everyday lives. And I'm so excited to have you here because you have a new role with the American Public Association. Do you want to tell us a little bit
Yes.
about that?
Thank you. Thank you for having me, and I'm so happy to converse with you today. I just joined as the executive board of American Public Health Association as an elected member for a 4-year term. So we, in fact, had our first meeting on the Sunday and Monday. So last Sunday and Monday of this week. So it was exciting, a lot to learn, and uh, it's going to be fun. And you mentioned about the public health month, the public health week, especially which the American Public Health Association organizes each year, is going to be April 3rd to 9th this year, April 3rd to 9th. So it goes for a whole week. And if one goes to the website, I don't know whether I can share the screen, but if you go to the website, you can see that for every day, Monday through Sunday, there is a theme for each day. For example, Monday is community, and then the Sunday, which is of special interest to you, is food and nutrition. Okay, so there are a lot of resources which are available on that website for each of these topics and each of these days. And I would recommend viewers to go to that particular site, which is the National Public Health Week, and they will see the American Public Health Association logo, and then they will also see the week and how the week unfolds. And they're going to have a lot of information in terms of the fact sheets, in terms of what could be done. I would recommend everybody to take a look at that and then participate, because that's important. Participation is important.
Very important. And yeah, I got this keep it moving challenge going on right now. And I'm trying to get people to sign up. And I don't know what it is. We tend to be these last, I get it, right? So we have that innovation adoption curve. So my early adopters already signed up. Now I'm trying to get that early majority in there. And I'm hoping maybe by the middle of the month, I'll
Yeah.
get the majority of people signed up. So I'm working on that. Dr. Gopal, but thank you for that. So if later on you want to share your screen, I did the little settings thing so you can.
Okay.
So what I'm going to
Thank
do, I'm
you.
going to go ahead and introduce our time today formally for our listeners. And I'm going to put your bio in the description when we post this video so that people can actually read for themselves some of the amazing things that you have done. So here we go. And my viewers know that I am healing through a concussion. So I'm going to be referencing my screen and reading from time to time so I can help myself stay on track. But here we go. Good
I'm sorry to
morning.
hear about the concussion and hope you feel better very soon.
Oh, thank you, Dr. Gopal. It's a process. I've been on a brain health diet, if you will, which is eating more plants, of course. And that is just so critical. I talk about this in my medical docu-series, by the way, but it's so critical, especially in the early phases of recovery from traumatic brain injury, to ensure that you are eating anti-inflammatory foods. And those are very simply put as plants, whole plant foods, steamed without oil or anything like that, to really help your brain kind of sort through the muck, what just happened, but it helps it also clean it out so that you begin to feel better a lot faster and all that jazz. So I go into all that in my docu-series, but thank you for your well wishes. I really appreciate it.
I would just add that plant-based nutrition is known to increase the longevity, and not only increase the longevity, but also increases at all ages, increases longevity at all ages, and particularly important at the time when our food habits are likely to take a dive, I would say, which is the youth, the college and the youth age. So somewhere around that 17, 18 years of age is something which we should be very careful about. in terms of changing over if we could. And the second is it is also related to food is related to the number of chronic inflammatory conditions, some of you which you mentioned, but also the common ones which we suffer from and then die from, like heart disease, cancer, metabolic diseases, certain other endocrinological diseases, and then inflammatory conditions of the musculoskeletal system like arthritis. So all these things are going to be helped by plant-based diet. The challenge is the food is something which is so personal. I'm not even saying cultural, because even within the same family, you can find that people have different food preferences. So it requires a community. When I say community, I'm not talking about 1,000 people. I'm talking about 3 people, talking about 4 people, could be a family as a community, which decides that we are going to go on a plant-based nutrition and then support one another during this process, because it's very easy to fall off the wagon, so to speak, in terms of getting back to the older habits which one has.
Absolutely. And you've nailed it. So we're going to skip the introduction and just jump right in, because this is what I like talking to Dr. Gopal. You're just so knowledgeable, and you just keep dropping that knowledge, and I love it. And I know our viewers are going to love it, and our listeners is going to love it too. So let's just jump in. What is public health? That's such a big term. People hear it all the time. How would you describe public health to the average person who's like, what?
It happens now, even after COVID-19, after seeing public health in action, it still happens. And the reason is public health is everything which is happening in the background. Let me give you 2 quick examples and then try to define it. One example is when we enter a room, for example. I don't mean a virtual room, a Zoom room, but when we enter a room, do we sniff? We don't. And that's because we are thinking that the air is going to be pure. The air is going to be breathable, that there's no discomfort which is going to come from breathing or inhaling in that particular room. So that's what public health is responsible for. The same thing for another thing which is very important for our life, which is water. When we turn on the faucet, we don't think about whether the water is clean or not. We drink the water. In fact, now, unfortunately, we have moved to the bottled water, but otherwise, most of the water in the United States and elsewhere is potable, which means that it's drinkable in most situations. In those situations, we don't think about whether the water is clean or not, but think about a situation where the water comes out to be green or it's brown, and the first thing we think about is, where are those public health people? So 2 essential things for our life, which is water and air, that's pure, and we get it every day, 24/7, 365. Every 4th year, we throw in a bonus 366 day, is clean. And that's what public health does. So public health, the whole notion of public health is how to keep the person healthy throughout the lifespan, and in the process, prevent diseases. And if somebody gets disease, how to pull them back to their health. So the focus is on health promotion, disease prevention, not at an individual level alone, but at a population level. And that population could be a community, could be a family as a unit, could be a city, could be a state, could be a country. It's the entire planet. So that's what public health is. And that's why it is very difficult to put one's arms around public health, because it's very huge. And that's why I wanted to give that example of each one of us is actually benefiting from public health.
Absolutely. And I think those descriptions give people a visual as well. Like, oh, yeah. So it's not just the electric company. No, it's public health officials around there making sure that the electricity coming to your home is safe. So that's really awesome. So why then is public health important?
I think public health is very important because when we look at the life expectancy, if you look at 1900, the life expectancy in the United States was closer to about 40, a little over 40. Even let's give it to be 45 years of age. And now when we look at the life expectancy, it is different between males and females, different in different races and ethnicities, but generally around 79, 80 years of age, even though it has taken a little dip because of the COVID-19 in the last 2 years. But that increase, the bulk of that increase is not because of medical care. it increases because of what occurred in public health. For example, good nutrition. For example, good environmental sanitation. For example, the immunization. For example, personal hygiene. So we need to think about public health as I would say, a guardian angel whom we don't see, but they're always looking out. The guardian angels are always looking out for us. And it is however many we want to have on our shoulders, they're looking after us. And that's what public health is. So let me give you a scenario. If public health were not to be there, what will happen? Think about Michigan, Flint, Michigan, what occurred over there when the water was contaminated. Think about all the food outbreaks which you hear about in different places. Think about the places where we go to and say that, no, I do not want to drink this water. I'm going to be careful. We think about the places where we say, oh my God, this place is not very clean. So all those things, the food which we eat, for example, so all these things have a hand of public health, but oftentimes it's an invisible hand to the person who is consuming. To the general population, it's invisible, and that's why it's necessary to think of public health. One other piece which I want to mention is immunization. Mm-hmm. Immunization, especially childhood immunization, is so important because if we withdraw all the immunization, which is part of public health services, then we are going to see a lot of our children die, suffer, and then die. And we cannot afford to do that. Morally, legally, ethically, we can't do that. And that's what public health helps to prevent.
Well, wow. Thank you for that. So let's just keep on this train going. You already started talking about this, but can you help our listeners understand how public health shows up in their everyday lives? I know you mentioned water, vaccinations, our food. How else does public health show up in our everyday lives? Like, can you bring it to where people can feel like they can touch it?
Oh, the minute we wake up, that we even wake up, how we wake up is important. For example, sleep. Do we get a good sleep? And to get a good sleep, we should go to bed relaxed. So mental health is absolutely critical. And I would, over the period of time that I've been in public health, I've come to realize that perhaps mental health supersedes physical health. A lot of people may not like me saying it that way, but I can say that. The reason is one could be in a place, a kid could be in Disney World or Disneyland and still could be unhappy. Mm-hmm. Okay.
Wow.
So it's very important for us to remember that the happiness which we feel in spite of the stressors around us is between our ears. And that happiness which is between our ears is what mental health is about, is how we deal with all the stresses of life. So early morning we get up. The very fact that we got up is because we slept in a place where the air was clean. So that's one example. We open the curtains probably, and then we see the sunshine out there and we see the greenery out there. And then we get into our vehicle, if we have a vehicle, or if we walk, whatever we do, if we get into a vehicle, seat belt, for example. For example, the vehicle inspection, which takes place every year, emission control, all those things are part of public health, because when I mentioned about the air being clean, we want to make sure that the contributors to air quality are carefully monitored and checked. So that's another example of that. Even before that, if we brush our teeth, which we should, then there's fluoride in the toothpaste. So that is to prevent dental cavities. So every step which we take, there is going to be public health's invisible hand, as I said. The only thing which we have to do is to, as we are doing right now, is to unpack it and see that public health is everywhere. Even if we are able to go to school, a child goes to school to catch the school bus, is because that child is healthy that day. And that healthy is because the child has been properly immunized. Right now, we are talking about the flu season. We are talking about the RSV. We are talking about COVID-19. We are talking about tripledemic. All these things requires proper prevention principles. Good hand washing, for example, not touching the nose, not touching the mouth. All these stuff can be taught at any age. And that's what we do. And that's what public health is. So the examples are just too numerous. Only thing is we got to look for them.
That's powerful. And I think that people, after seeing this podcast and listening to it, will have a better understanding of what public health is. You talked about environmental health. We're seeing the impacts of how we have not loved our planet the way we should have been. And now we have more global warming, if you will. So we're retaining more moisture. Therefore, there's more flooding. We're losing our glaciers. And it may seem like nothing to some people, but it's significant. We don't know all of the archaea or protozoa or bacteria that's hanging out in the glaciers. We don't know everything yet. And we don't know how losing that could impact our food supply. We just don't know. We don't know how it can impact the quality of air that we breathe or the quality of water. Like there's so much we don't know. And I think we still have an opportunity, if we want to turn things around and begin to love our planet, love nature, be respectful of it, and it will love us back and bless us back with clean air and, less flooding and forest fires and wildfires, whatever we call them. So thank you for that.
One more thing I would add is that each one of us can make a difference. And that difference can be positive or that difference could be negative. For example, if someone is using a lot of alcohol, not only they are going to have nutritional problems because they're going to show nutritional deficiencies, but if they get behind a wheel, they're not only a danger to themselves, but they are a danger to others. Is to property. But at the same time, that person can work in a soup kitchen and help other people get good nutrition, or even a meal, which they may not get. So the point is, each one of us is capable of doing good things. Each one of us is capable of being misguided. It is necessary for public health. And as you said, our planet's viability, our planet's survival, our planet's fitness, which contributes to individual fitness, individual health, and individual prosperity, individual longevity, individual productivity. All those things depends on what each one of us can do and does.
And that's so powerful because you hit the nail on the head that these are individual decisions that we are making every day that are collectively either contributing to our planet's health or subtracting from it, taking away from it. I was just saying the other day to someone how, you are somebody's baby, I'm somebody's baby, and that creates the family unit. That family unit with other family units creates a neighborhood. That neighborhood creates community. We send a representative to what we call our governing bodies to represent us at local, regional, state, and national levels. And collectively, you are somebody's grandchild. I like to put it that way because I want people to visualize the president of the United States and your congressional folks. That's somebody's baby. And so, I like to say, think about how your grandmama would feel with you making some of these decisions. So yes, we have people that we want to trust to make collective decisions for the betterment of all. But at the end of the day, like you said, everybody's decision every day is public health, and it's either contributing to the health and well-being of our global landscape, or it's taking away from it. And so we have the power then in our own hands to make decisions that will allow us to live our best quality of life. And I love that you brought up mental health as well.
Well said. And I would add that, it is something which I like to travel. And when I travel, I always listen to what the flight attendants mention. If there is turbulence, if the oxygen masks come down, first put it on your face, take a deep breath, and then help the person next to you. So unless we help ourselves first, we cannot do good for others. And that's one of the reasons why I was saying that the realization has come to me that more important than physical health, I don't want to put them into a competition, but what I'm saying is mental health usually virtually across the world hasn't gotten the same kind of attention and resources as it is for physical health. But perhaps we got to think about it more carefully and switch some of the resources to mental health. Because if I am healthy mentally, I'm more likely to keep myself healthy physically. If I can do both those things, I'm going to be more useful to others in terms of some of the things which we talked about recently.
Absolutely. And that's so key. I've been saying this more now than ever before, that when I feel better, I want to spend more. I want to do fun things. And so I know the power, and I have this equation that I came up with: gut health plus movement equals mental health. If we love our planet, if we love our animals, if we love the water quality systems and all that jazz, I promise you, I would much rather spend $35 and put that towards a massage than a copay at the doctor's office, because of some of the decisions I'm making about consumption of processed foods, or sitting in front of a screen all day, not moving my body, rehearsing narratives that may or may not be true. And they may be very real to people. I'm not minimizing that. But when there's cause and effect. Our first immune system, we have nerve endings in our gut. So what we eat impacts how we feel. And so if we are under the pressures of life, and then we couple that with a meal that makes us feel like crap, we're going to have a very challenging time trying to even keep our head on straight, what we call mental health. And I was just saying the other day, maybe we should say brain health. I don't know why mental health scares people. Brain health, whatever you want to call it. The reality is, like you're saying, if we really have to take care of this, because this is where we're making decisions, really our gut, but about what to eat, whether we feel like moving, things like that. And we can do it. I think it goes back to what you alluded to. These are individual decisions. Walking is free, is what I tell people. You don't necessarily need a gym membership. Running is free. Even volunteering is free. All these ways you can get movement into your life, and get out and socialize with other people, be around nature, which we know is important as well with our mental health. I'm going to get off this soapbox.
No, I think you have brought out several important things for everybody to consider. In fact, when we are growing up, we used to call that each one of us as a bus. And they said, what? We didn't even have a car when we were growing up. When I was young and we were going to school, the only thing which we had was one bicycle, which my father had. So when we were told that we all have a bus, we said, what bus is that? That's bus number 11. That's our legs, the legs which can move like that. That's bus number 11, because everywhere, wherever we needed to go, we used to take the bus, the public transportation. So that's what is. I would also encourage everybody to take a look at the Mental Health America. The Mental Health America has got 10 tools, and those 10 tools are talk about one of them, of course, is eat well, and it talks about exercise, staying positive, helping others, and so on and so forth. And if they click on that link, then it takes them and gives them much better description in terms of actual action items. And the reason why I say that is that all these things come together. All these things come together. Mental health is not simply, oh, I want to be happy. We can be happy only if, as you pointed out, we eat right, we eat the right foods at the right time in the right quantity, and all those things are absolutely critical. But at the same time, exercise is important. Sleep is important. What kind of connections we have. And that is a big challenge now. To give you one example of that is even adults, including myself, spend a lot more time because of smartphones. When before smartphone, I had more time. So now I'm trying to recapture that time. That's the negative problem with because it's easy to lose track of time. But the positive thing about that is every day morning, I'm connected to my friends whom I went to high school with. I'm connected with friends whom I went to medical school with. So that kind of a joy to be connected with people whom you haven't seen for 40 years in school is probably close to 50 years is a gift. It's a blessing. But those things, again, everything, it's as they say, even the best thing which we can have in life, it has to be in moderation. And that moderation has to be, cannot come from outside, that it is forced. We tell the children that you shouldn't have more than 1 hour of screen time per day, not per hour, but per day. But the point is, when adults, we have to have that self-control, because if we don't have that self-control, we cannot relay that to others.
Absolutely. And self-control, that's what it really comes down to and what we value. A few years ago, and if you want to bring up that screen so we can show our viewers what you're referring to, a few years ago, maybe a little longer than that, I was thinking about, well, what was different in the Bible days? Like, how did people spend their time, and what happened around, what we call the ancient times? And the one theme I began to see as I was reading from Genesis to Revelation, if you will, is this idea of the importance of taking time for family, celebration, and community, and of course work. But they had such balance. They knew what was important, and in those cultures, whether they were considered, Pharisee, Sadducee, whatever, it didn't matter. The theme that I saw, even when you study the Roman Empire, for example, was community and family and doing the things that matter. And I believe that this pandemic has shown a lot of us what matters. And it's not that screen time. We realized very quickly, oh my gosh, I miss physical touch, or I miss being in the presence of fill in the blank, that smile on my mom's face, or that hug I get from my aunt. Suddenly, we have this blessing, if you will. I'm not minimizing the tragedies that came with the pandemic, but I think it was a nice, maybe not say nice, but it was a blessing to have that pause for a lot of people to reconnect and to not take for granted physical touch. Computers will never replace that. I don't care how much AI they come up with. It is never going to replace a hug from my mom, a smile from Dr. Gopal. It's not going to replace it. It's not going to do it.
Absolutely. And that's why this is what I'm sharing right now is the Mental Health America, the 10 tools. And when you look at the 10 tools, they connect with others, stay positive, get physically active. The first one is connect with others. And that's what you're just elaborating so eloquently and beautifully. Help others, get enough sleep, create joy and satisfaction, eat well, take care of your spirit, which is spirituality, deal better with hard times, better scoping skills, get professional help if you need it. And this is very cultural. A lot of people, especially older people, especially people who do not come from cultures where mental health is right on top, or where they could put mental health on top because of the various family circumstances they are in, people don't seek help at the time when they should. So these are the 10 tools. And if one clicks on this tool, like I have done it for the How Connections Help, there are a number of things which are mentioned over here in terms of how it is helpful, and these are research-based. So that's the reason why I said that these 10 will be really useful if we want to bring our life to be more productive, more healthy, and of all the things, it is success is there. But what is probably most important is happiness and inner peace. Yeah. And I think this will really help that. The one other thing which I wanted to share was let me make sure that are you able to see the National Public Health Week?
Yes.
This is from the American Public Health Association. And this is what I mentioned initially, that the National Public Health theme has got every day they have a different theme, and they have fact sheets for each one of them. And I would definitely encourage the viewers to take a peek at it and then see whatever is useful for each one. But what I would assure, and I could even extend to say that I promise, is that at least some of them will be useful because they connect to parts of our life. And that is what the Public Health Week is, to bring focus to the things which are happening in our lives.
Thank you so much for that, Dr. Gopal. And I appreciate these resources, and I know our viewers will too. Want to also drop in the plug, the new easy way to connect with someone if you need to talk about anything. 988 is the new support number, if you will. So we'll take credit for this, Dr. Gopal. In the public health community, we've gotten rid of that long 1-800 number, but now just 988. And you can even text that number if you're not comfortable calling to initiate a conversation with someone to talk through whatever it is that you are facing. So you are not alone. I want to stress that so much. I also want to add, when you were showing about the National Public Health Week, I started to think about my recovery through traumatic brain injury and how important community was for me, and even just allowing myself to manage those life difficulties. So I just want to tell people out there that are listening, it's okay to feel what you feel. Your feelings are very real. They're valid. It's okay to cry. It's okay to raise your hand and say, I don't feel like myself today. Something's not right. I need help. So if you have no one that you can go to that you trust, family or friends or coworkers or whatever, a neighbor, please use the 988 number and get support, because you're not alone. And believe it or not, sometimes when we're under duress or stress and things like that, we're not necessarily thinking straight or rational. And so we don't even see that we are surrounded by community. So tell yourself the greater story is what I'll say. Reach out. You've seen the support resources that Dr. Gopal has provided. I'm going to put that below in the description, so you have not only access to the work he's doing with the American Public Association, even at Westchester University where he is, but also the National Public Health Week and the Mental Health Association website that Dr. Gopal showed us. Dr. Gopal, do you have any closing
One
words?
other thing which I would mention is the mental health first aid. Mental health first aid is a free program which is offered, and it is a certification. It's an 8-hour program. Prior to COVID-19, it was offered as a one-day program, but since 8 hours may be difficult for people to come in for a full 8 hours at the same time, so 4 hours is now offered. The option exists for 4 hours to be offered online, and then the 4 hours in person. So mental health first aid, MHFA, and it's a free offering. It is offered in institutions, educational institutions. It is offered in community through the hospitals and other institutions which are there, health departments, for example, and it provides the person very similar to learning about CPR or first aid, but this is for brain health, as you mentioned. This is for that, and the certification lasts for 3 years, and anyone of any age can participate in it and get certified. I would strongly encourage people to do that, because as you mentioned, the awareness. We are human beings. We all have emotions. We demonstrate emotions. When we don't demonstrate emotions, it's a problem. But when we are sad for a couple of weeks, because all of us get the blues, but we get over the blues very quickly. But anything which lasts for more than 2 weeks, then certainly requires some attention.
Absolutely. And I was going to ask you for your closing words, and you just gave it to us. But that is so true. If it lasts for more than 2 weeks, or if you're cycling every 2 weeks as well, you definitely want to reach out for some support. And it definitely can be related to your diet, believe it or not. But you need to speak with someone that's trained to be able to help you identify your root cause and, put together something that you can feasibly do to work through those challenges.
The last thing I would say is when you look at the parameters or the guidelines, to give you one example of sleep says adults should require 7 to 8 hours of sleep. Nutrition, certain amount of calories and the distribution of calories and so on. And exercise, 150 minutes of moderate physical activity. Many of people may not be able to do that immediately. So don't think of that big goal. Think of it, as the computer people say, bite by bite. We don't eat a whole cake. We might eat it in the whole setting. I wouldn't recommend it. But the point is, we take spoonful. So even if you can make change for 5 minutes a day, you can walk, then increase it to 10 minutes a day of walking, 15 minutes. Same thing with food. You can include more plants into the plant-based items into the nutrition. That is good. You don't have to change over the next day. It can be done incrementally, it can be done slowly, it can be done purposefully, it can be done intentionally, and we all can make it.
Oh, thank you, Dr. Gopal. That was wonderful. And there is nothing else to be said after that because those were awesome closing remarks. We can make change one step at a time, one decision at a time. It doesn't have to be all at once, right? Because they say Rome wasn't built in a day. How do you eat an elephant? One bite at a time. How do you eat a cake? One bite at a time.
Thank you so much, Ethel. I greatly appreciate you having me.
Thank you so much, Dr. Gopal. You're welcome. I'm so glad that we were able to connect. And we want to say happy National Public Health Week to all of you. We hope that you are participating in all of the events. If you have any questions, you can reach out to the National Public Health Week team. It's on the website. We'll put the link in the description. And we hope you have an amazing April. Happy spring. And we look forward to seeing you again next time in the kitchen with the Plant Based Nutritionista. Take care.
Thank you. Bye-bye.
Bye.